who might miss it. So I will put it on our YouTube channel, and then we could send it out. If you request it, I can send it out to you as well. But I'm excited for you all to attend our mini event of our Transition Tuesdays. As you guys kind of know, our St. Louis Interagency Partnership started a couple of years ago to get together agencies who work with youth in St. Louis City and County to share about different programs and projects and information, staff to get to know each other. So we've been putting on events for a couple of years now and doing Transition Tuesdays for the last couple of years in October, November. But I heard from Marissa, and we decided to do this mini event so you guys can learn about some of their new and expanded program. And we're happy to do this with other things as well. As you guys think of other things you'd like to learn more about or programs you'd like to hear more about, let me know, and we can see about doing kind of guests throughout the year as little mini events. But I am Amy Sickerman. I will put my email address in the chat. You can always send me ideas of things that you would love to hear more about on transition or working with youth and the say in the community and programs and things like that. But I am here to welcome our guest speakers. We have Marissa Hyatt from Mercy and Dr. Bruno as well. And they are here to talk about their program. And Marissa, you are free to share. I am turning it over to you.
Thank you, Amy. Hello, everybody. It's so nice. I know so many people on the screen, so I feel very welcome here, and I'm excited to share with you some of the things that Mercy has always done, some things that we've revamped, and just reminding everybody that we are a great employer. We're an inclusive employer, and we're doing a lot of fun things. And so my role here at Mercy is Disability and Inclusion Operations Manager. So I oversee all of our inclusive efforts throughout our whole organization, so across 3 different states. But of course, St. Louis is my favorite because we have all these specialized programs that we get to operate here that hopefully we can duplicate in other areas. So I have Dr. John Bruno with us today. So if you wanted to introduce yourself, Dr. B, go ahead.
Hello, and I think some of you, we were just together yesterday, so good to see some of you again. Dr. John Bruno, and about 4 months ago, I joined the Mercy team, took Cole Sibley's position and picking up where Cole brought it and going from there. And just a quick, we are really in the process of kind of moving into Marissa's vision of shifting this from a supported volunteer to more of the pre-employment. So we've always had some volunteers that have moved into employment, but now we're being much more intentional about moving resources in that direction, lining up opportunities. And so that's what Marissa's here to talk to you about today.
Yeah, so I actually threw together a PowerPoint yesterday for my friends with Mizzou, and I thought it had some really great content. Obviously, we have programming at Mercy St. Louis for individuals with developmental disabilities, but if you guys are working with youth that just want to get a job or interested in healthcare, you know, we're open to those discussions as well. So I'm just going to share my screen really fast if I can find it.
Marissa, correct me if I'm wrong, but this is not just youth. This is all ages.
Yes, but we really want to see some young people in our facilities and getting them excited about healthcare. But yes, I mean, I'm your contact person for anybody who wants a job. Really, I can help connect with that right recruiter, that right programming, all of that. So I'm just going to walk through some things. I kind of wanted to educate you guys a little bit on the different types of jobs at Mercy, just because we do have positions for people who are 16. You don't need a high school diploma for. So I'm just going to touch a little bit about those entry-level jobs. So if you do have someone you're working with that is excited about working and can balance both a school and a job, we can talk about that. So as you're talking to youth and talking to them about a hospital, I think sometimes it's it's a little scary, or what jobs could I do, or I don't want to clean at a hospital sort of thing. But we really try to talk to people about how it's a little city, and we have every position you could ever imagine because we have to operate 24/7, 365 days a year. And so any position that you're doing is helping in the healing process of a patient. And so no matter what that position is, it is just as important as our doctors and nurses. And so, and we have career ladders in almost every department. So if a young person wants to start out somewhere at Mercy, their trajectory can be as big as they want it because we do have so many different roles. So I just like to say that when I'm talking to younger people about hospitals, because I knew that if someone had talked to me, maybe I would have started at a hospital a little bit sooner in life. So this is just a little printout of, you know, some projected positions that are high demand in healthcare. And so as you can see, obviously we are always hiring for nurses, surgical technicians, home health, right? That's a big one. Respiratory therapists, medical assistants. I was talking to Laura about our clinics. So you see Mercy clinics everywhere in our area. They're really needing medical assistants. So that's usually just a 2-year degree. And so those are the people that are taking you to your room, taking your vitals, asking you those questions and getting your information in the chart. Sterile processing, so that would be for someone who's totally okay gearing up and covering their face and seeing blood and guts and cleaning off instruments. I have yet to go into that unit because I'm not sure I'd be qualified to, I would pass out probably, let's be honest. So that's an interesting one though, but there's a career ladder there as well. And then supply chain, that's a really awesome one, right? We have to bring all the supplies in. So we have material handlers, and then we have to get the supplies throughout the hospital. And so there's a lot of important jobs that go along with that. So again, as you're talking to our youth and just talking about these different roles that maybe they would not even think of in their future. Again, I'm going to touch base on the 3 jobs that don't require a high school diploma: housekeeper, food service, transporter. So these are the jobs where we see young people getting their foot in the door at the hospital. So patient transporter, just FYI, is probably our hardest entry level job. I think Dr. B can tell you stories. He's been walking around this hospital shadowing patient transporters. You go all over, you're in every department. It's a great position to see if you want to take your career to the next level in as far as healthcare. So you're interacting with nurses and doctors and patients, and strong customer service skills are needed for that one. So again, these are some positions that they could, you know, start off, you know, even over the summer, things like that. Supply chain, just again, we touched on that a little bit. So this is one of our coworkers, Adam. I'm not sure what he's doing, but it looks important. A lot of times, you know, we have to just make sure that we're pulling. There's a lot of demand for being accurate in counting, making sure we're getting the right supplies to the right places, things like that. But they're walking all over the hospital as well, a lot of times, just making sure that we're getting the supplies to where they need to be. And then patient access representative, again, I'm picking on Laura because I just talked to her yesterday, but we see a lot of younger people wanting some more of those clerical or maybe more office-y type of roles. And so patient access representative is one where that's where you're kind of doing some scheduling. This can be remote or at one of our locations. And so it'll say on the job description, but this is where we're, you know, strong customer skills are needed, right? You're going to be working with our patients, getting them scheduling them, things like that, directing them where they need to go if you're on site, things like that. So these were just highlights I wanted to share with you guys as you're talking to young people about maybe working at a hospital. Any questions? I can't really see, I only see Amy and Laura, so I'm going to pick on them. Okay, well, I'm going to toss it over to Dr. Bruno to talk about, as he mentioned, we have always had a supported volunteer program. We've probably been operating that program at least 12 to 15 years. I don't really know exact date when we started that. But over the last 6 months, we've really been shifting our mindset to a real pre-employment training opportunity for individuals who have a developmental disability. And right now, what we're leaning on you guys is that we really need volunteers that they have to live in St. Louis County, but we also are welcoming St. Louis City residents. So we'd love to have some St. Louis City residents come participate in that program. And we know that transportation is probably the biggest barrier. So maybe we could work something out, but I'll have Dr. B kind of jump in and kind of talk about what the program looks like and what he's doing with the volunteers. Oh, we can't hear you.
Thank you. Forgot I was muted. So in meeting yesterday, you know, there was a lot of understandings of the way the program was in the past or other issues. And so just a chance to kind of explain where we're at now and then see if we can answer questions or concerns. So as I mentioned, we take on volunteers happily. We've got a number who've been volunteering for 10, 11 years. They just want to volunteer. They like to come and do some good and also socialize. What we've done is we've mostly moved the volunteers into either a Monday or Friday slot. Not that it has to be. We've got other volunteers who come other days, but in general, that's what we're doing with those guys. And then we've shifted our resources towards those that have been sent to us who either, had been placed multiple times and just haven't had success. And so we're going to work on those social skills with them. Or it's those that just need to explore some other possible positions. But if they come to us and are interested in working, then we start trying to line them up so we can get them into all those different places that were on Marissa's slides before. We can give them experiences in the kitchen, in sanitizing things, in linens, patient transport, doing some data entry. And so again, our goal is to let them try some things. And again, I didn't even know some of these things existed, in the workplace until I got to the hospital. So there's all kinds of things. And those individuals are coming. Usually they'll start for about a 3 or 4 hour shift once a week. And once we find something and they say, hey, this is it, I want to do patient transport, or I want to do equipment technician, or then we'll get them up to 2 days a week. And then we start really strategically getting them more and more experience of what that is going to feel like when you're working in that role. And so we want to make sure that this is going to be a good fit. You're not, being surprised by anything. And then we have the ability to either, if they've got enough skills to where I've got a coordinator, I've got a full-time job coach that we're hiring for right now. And then I've got 4 or 5 PRN job coaches that only come in 1 day a week. So we've got the resources to then target support for those individuals as they start to shadow another coworker, or we'll actually get them with the trainer for that department, and they'll start shadowing as he's training somebody else, and they'll experience some of the training. And here our goal is that if there's going to be some hiccups, some resistance, some part of the job or endurance, we want to find out before you apply, and then find out it's not going to be a good fit. So again, as much as possible, we're going to get them up to speed. In some cases, they're able to take on that role with minimal support. At that point, we would hand it off to Paul's group, and that long-term support would kick in and do that supported employment. If they would benefit from more intensive support in the actual role, then that's when we would recommend them back to their VR case manager and open that case. And then let's get them somebody from one of the agencies to come in with them and get them that training. So again, we're flexible. We can flex with whatever the needs are, but we're going to try and do what's best to get them employed. And Mercy is committed to the inclusion efforts here. And so Marissa's worked hard with Paul to really build those relationships with these hiring managers. They've been trained in how to interview differently. And so we've already had a couple of experiences with interview fairs, and they've gained experience. And we've been really impressed with those hiring managers and how they've really adjusted to looking for our individuals and asking us about it. So again, right now we've got the ability to handle St. Louis County and St. Louis City, but we don't have of individuals from the city yet. And so we're looking to grow that segment of our support. We're working on with St. Charles as well. We've got at least 2 individuals that are coming from St. Charles, but they're not covered under our program. So we're setting them up with the regular volunteer office and then supporting them and hopefully get them into employment as well. But right now that's our target. Marissa, would you add anything else, or did I leave something out you want to make sure we mention?
I want to hit the highlights that Dr. Bruno is doing what we call coworker readiness training, which is really highlighting those social skills piece of it, because we know that a lot of times it's those social skills that get people either in trouble or fired. And so just want to brag on that a little bit, Dr. V, because you've been doing really great things, just helping individuals understand, you know, facial expressions and body language and just those little things that you and I take for granted when you're in a work environment, right? Because those can, you know, show that when you're making an error, you can make adjustments. Well, Dr. V's trying to help them realize that. So, and all the other thing, I mean, all the things that go along with social skills, but that's been a huge, it's been a joy to watch that progression.
Yeah, so let me mention that coworker readiness training course that I'm doing with individuals. So individuals will either usually volunteer from like a 10 to noon or an 11 to 2. And then that overlap, I'll teach that course at 11. So that way I can get both groups in for the training. Part of Mercy's commitment is they, if you volunteer, they provide a $5 voucher. And so the individuals then go to lunch together and they're sitting in with all the other coworkers. Most of the time I'm sitting at lunch with them as well. And then we're practicing social skills there as well. So there I'm just reinforcing, oh, hang on, we're having one conversation at a time, or, you know, oh, that's an interesting topic, but is it really appropriate when you're with coworkers? And so there, you know, it's that chance to shape those skills that we know are those soft skills that go along with when they're not necessarily actually doing the work, but actually in those social situations. And then the other question that I got yesterday was, you know, well, what if they came to volunteer, but then maybe they want to work? And so that's fine. You can start off volunteering and then all of a sudden realize you want to do something. The story I shared yesterday was one individual who'd been with Walmart for years. And as I was teaching the guys how to read facial expressions and read emotions, he came in a few weeks ago and said, Dr. Bruno, I quit at Walmart. And I said, why'd you quit? And his answer was that, you know, all these years I thought we were all joking together, but I realized they were making fun of me. And so we are now getting him placed at Mercy South. So we are now working hard to get him a better place. Right?
Yes, yes.
So those are the kind of things that we're doing and we're real proud of. And we've had some great success. We've got at least about 4 individuals that are about to move employment in the next couple of weeks. And then what we don't have on the screen is also we have the rehab center up the road where we can place individuals. And the rehab center is nice because it's a much smaller environment. Everybody there is it's a much closer group of team there. And so there for some of our individuals, that's a better fit just because the size of this place can be one of the issues that can be in the way. So anything else, Marissa, you would want to make sure we get it across?
Can you review the eligibility requirements for the program, Marissa?
Yeah, so for the supported volunteer program, the pre-employment program, you have to live in St. Louis County or St. Louis City with a developmental or intellectual disability. So you have to meet those PLB and DDR guidelines for eligibility for the volunteering program.
You do not have to have a case manager, correct?
No.
I'll mention that because we are healthcare, they do require COVID vaccination and annual flu shot. Now, Mercy will provide all of that, of course, but it is required. It is one of the ones that will keep people from coming sometimes.
So if we have a client or an individual who maybe is not quite ready for employment, are you saying that's a good fit for this program to kind of work on their skills if they maybe want to work in this type of environment? And then what would their schedule look like for the week doing this program?
So if they're looking for work, then they'll tell us what day they can come. So it you know, it can be Monday, Tuesday, Thursday, Friday is when we try and leave Wednesday just for a day to kind of regroup. But we have some who come on Wednesday. So we'll fit to their schedule. And then again, we'll either try and get that morning slot of 4 hour, 3 to 4 hours, or that afternoon slot. So it's up to them. And then we'll customize from there. If they're more suited to kind of that group work, then the Friday groups are doing more of the group kinds of things. So they're in a group of 3 doing Meals on Wheels, for instance, and getting those food packages out to go to those people in Meals on Wheels, or they're putting packets together of supplies for a department. So surgical sponges, 2 per bag, and that kind of thing. So the Monday, Friday group would be more of, if they're more in line for that kind of group type setting environment. But on Mondays and Fridays, we also have supported individuals who are getting the more individualized support as well.
So, Amy, we usually start people off 1 day a week just to determine what their, level of motivation and skills, and, the hospital can be overwhelming. It's a big place and there's lots of sensory things going on. So we usually start off 1 day a week, and then as they progress and, advocate for themselves that they want to, if they want to work and gain those skills, then we can add those days.
If there's a VR counselor or a DMH worker, a regional center worker, school teacher, anything like that, they would just refer them to you guys then, and they would, I guess, do an intake with you for the program?
Yep, Dr. B is the contact person, so I'll make sure you have his email, or if you can share it to the group, that'd be great.
If you just want to pop it in the chat, Dr. B, that would be perfect.
All right.
Well, and then, so I know he was saying that if a student or an individual was going to be offered a position but needed more coaching, then they would be referred back to VR so that we could get that coach. And I know a question we had yesterday was, are we looking at specific agencies for specific coaching places anymore, or is it open?
We just can't do that anymore with the way agencies, everybody's in a staffing crisis, the way agencies, I think we would just have to work with VR and, determine who's the, there's just so much change now that I don't think we could really do that successfully. So we want to make sure that the person has the support they need, whatever agency that is.
You guys can work with any agency then.
Mm-hmm. Yeah, and we would work closely. So that's where Paul's team would come in. And so I can share about, Paul's out on medical leave right now, so I can share about supported employment. So if that person is moving towards supported employment, Paul would work closely with that agency to make sure, that the coach has what they need in preparation. And so I can tell you, coaching at a hospital is definitely different than coaching anywhere else. And so there's lots of things to just keep in mind when we're sending coaches out, dress code, customer service, just all those things. I mean, Mercy has a lot of policies and procedures. And so just making sure that our coach is emulating that so that our coworker is able to follow. So, but Paul works closely
with the other question we got
agencies.
yesterday was, do they have to go through coworker health and have the vaccination?
The coaches.
Yeah, we are, I'm going to say yes, because it's a joint commission thing. And so we will be coming out with a process, whether that's an agreement that says the agency will produce those things if needed. But we're in the process of working with our legal department to make sure we're following the rules. So I don't have a 100% question, just yes or no, but we're going to have something that will be required.
If somebody wanted to take a tour or anything, would they be able to do that with you guys?
Yeah. So let me touch bases. Are there any questions about supported volunteering for Dr. B? Okay. Well, if you think
Feel
of
free
them,
to unmute yourself.
I can't see anybody except Amy.
I don't see anything in the chat yet, so.
Okay, well, I hope everybody's thinking of all the people they're going to send us. So on the flip side of things, we have our supported employment model that Paul Leonard is the supervisor. And so he would be your contact person if you have somebody with a developmental disability. We can serve all 4 counties in this program. So if they live in St. Charles and want to work at Mercy, if they live in Jefferson County and want to work at Mercy South, if they live in St. Louis City, and obviously PLB, we're PLB funded, so in St. Louis County. And so right now we have over 80 supported coworkers between Mercy St. Louis and Mercy South, which means that we're providing that long-term follow along. So in the past, I know you guys, we had outside agencies coming in providing that support. Well, now Mercy is the support. So we have 3 employment specialists that work on site full-time, supporting these coworkers and everything that is Mercy. And so we really take a proactive approach because, we're seeing people not just once or twice a month. I mean, we're seeing sometimes people every day and helping them navigate all the things that they need. So obviously, if you have somebody who would be better for the volunteer and they could move into that coworker status, or if you have someone who has experience and they can just apply for a job, Paul would be that contact person. And so again, they do have to have a developmental or intellectual disability and meet those guidelines of the Alliance boards. So we are always welcoming coworkers in that regard too. So if you have somebody who's just ready to work, then I would reach out to Paul. So any questions on that? Such a silent group.
They're all just amazed at the things you're doing,
Yes,
I'm sure.
that's Amy, you're so spot on. So the one thing you led me into the next thing, Amy, you read my mind. And so we are now with COVID, you know, I wouldn't say we're out of COVID, but now we're just living with COVID. So we are opened up a little bit. Okay. And so this is a photo of our Dream Big camp where we partnered with Starclough Disability Institute, and we were able to host probably 10 students, and we took different tours around Mercy over the summer. And this is us in the lab. And so we are able to set up shadowing at Mercy St. Louis or Mercy South. I am working on an interest form because I'm working with some lovely transition specialists at McClure North and Parkway West, and we're having students coming through. But it is a process, and it does take a lot of coordination. And so I am going to kind of make a more standardized process. So if you are interested, please reach out to me. We'll make it work. It would probably be in the best interest to have a group. One-on-one shadowing is a little bit more time consuming. I am going to send you, Amy, a link for Lunch with the Leader. And so it's on YouTube, and we did a virtual kind of, here's two leaders of two different departments. They give you a deep dive into all these different positions. So this is a great place to start. So what is really hard when people come to me and they say, I have a candidate that wants to work in a hospital, where should they work? We have 6,000 job openings every day. I don't know. So I don't job develop anymore. So my advice to you guys is to check out these Lunch with the Leader series, do a little research, kind of narrow down some of those ideas, and then I can help you get connected. But it's really hard for me to just look at a resume. We have just so many different opportunities. And so the Lunch with the Leader series is a great place to start with anybody when they're kind of looking at a hospital. So but if you know that you have 3 students who are interested in like learning about nursing or lab or more of that clinical stuff, that's good to know. I can set stuff up. If you want to just learn, shadow our entry level positions, we can do that too. So we're definitely open to that. I'm going to stop sharing because I don't like to not see. Okay, so the other thing I just wanted to share is that we are going to be at the host site to 7 summer work experiences this year, 6 in Missouri and 1 in Oklahoma City. So keep a lookout for that. And that I say that Casey Wisdom is on here, but we have Pathway to Employment programs across the state as well. So if you wanted to learn more about that, I'm happy to share. But I just kind of wanted to hit the highlights that our supported employment and our pre-employment programs in Mercy St. Louis and Mercy South are actively recruiting, and hope we can partner in the future.
Anything you want to send me, I will send out to the group.
Okay. I can do that.
Hi, Marissa. This is Jessica Miller from the West Office.
Hi,
I do have a
Jessica.
question. How are you?
I'm good. And thank you again for coming to our event in October.
Oh, not a problem. Not a problem. And thank you so much for doing this, hosting this training. I do have a question. So I am I am the counselor that's over SSD's VSET program through DePaul Hospital.
Mhm.
And I have a young man, and we have his planning meeting upcoming this Friday, and he is doing kind of a similar position as that patient representative. Hold on.
Patient access.
Yes, patient access representative. And so I was gonna talk to him because the training that he was receiving through DePaul could be maybe similar to something what's going on with Mercy. Now, if he had an interest in a particular job through there, would I help him get in contact with Paul? Is that
Yeah. Paul or myself. So you
Okay.
can include both of us, and then either of us will take lead depending if he qualifies for Paul's program or not. So
okay?
usually if the person doesn't qualify for supported employment, I'm kind of the contact person for all those other requests.
Okay. Well, he, I believe, meets all the criteria with the
Perfect.
developmental
Yeah, so-
disability, MSD.
Yeah.
everything.
It'd be
so.
great to reach out to Paul because then he can make sure we get the right rec and the recruiter, and you know, we would kind of play it from that end instead of applying and then following up.
Perfect. Will we have, will, Paul's contact information be in the, chat or?
Yeah, I'll put it right here.
Awesome. Thank you, Marissa.
Uh-huh. And he should be back next week.
Okay,
So,
perfect. Thank you.
oh, thank you, whoever put that in there. Well, we're excited to be here, and so if you guys have any other questions, I'll send you as much information as I can so that you guys feel better prepared when, you know, talking to folks about Mercy.
Does anybody else have any other questions? You can put them in the chat. You can unmute yourself and go ahead and ask away.
I can start picking on people that I know.
They might not like you very much for that.
I was gonna say Joe Byrne better ask me a question.
No, I have a guy actually for supply chain. I'm gonna shoot you a call later maybe and talk about that.
Okay, that would be great. We'd love to have him. I know we really need some support in our linen department. We are we do have robots in our building. So our robots, what we call tugs, are actually not as bad as everybody thinks. They're not taking jobs away. They're just making jobs different, actually a little bit better because they're taking a lot of the steps and the physicality out of the job. And so we're going to be seeing some robots helping out in our food, you know, delivering trays, delivering linen, that sort of thing. So just a heads up, maybe young people think that's cool that there's a robot. I don't know.
Oh, thank you, Marissa. Really great information today. Really insightful and fantastic work you're doing over there at Mercy. Really appreciate you sharing it with us. And you too, Dr. Bruno.
Excited that you're opening it up to the city residents now too, who can get the chance to kind of go into that pre-employment and work on their skills and then hopefully move right on over to that coworker status once they're ready.
Yes, and we are working with Enterprise to hopefully come up with a van pooling option. And if that's the case, we're going to be working with the Alliance boards for them to help support fund whatever cost that is for our volunteers and our coworkers. So I should have an update on Enterprise probably by summer because that's how long it's taking.
Is there a shuttle from the ballast station to your campus?
Dr. B knows all about the shuttles.
I'm pretty sure there is, but if not, they can call. There's a number you call and the shuttle will come get them at the station. But I don't know if it's running on a regular basis. They keep changing between regular and on call. So, but you could call the Mercy number, the shuttle number, and they'll come get the employees.
Y'all, if anybody's driven past lately, you see that big building that's getting built across the street. That's our new like sports medicine outpatient surgery. It's like a really long name, multifunctional something or other. We're having a job fair to staff that. They're going to need all entry-level positions there. So kitchen, cleaning, all those things. So I'm getting a flyer from recruitment so I can share that with you, Amy, too. They're going to have some open interviews and things like that. So just more jobs. So that adds to our 6,000, I think. Now we're probably up to 7,000.
So Marissa, they can do the pre-employment at Mercy South or Big Mercy. Is that correct? Can they do it at the rehab? Okay.
Marissa,
Yeah,
this
so
is
I've
Kendra.
got
Can you hear me?
got coaches at both those places.
Oh, yes. Hi, Kenda.
Sorry. I'm a little more curious about the job shadowing you were talking about earlier. Who is it that is coordinated through?
You would work with me.
Okay, and what is the time frame? Like if I was to get a hold of you because we have a student who's interested in participating with that, what's the turnaround time that could be scheduled? Is it a couple months out or a couple weeks out?
That is all kind of new to us, to be honest. Dana Brodier is still working 2 days a week, and she's been really helpful to me to do that. Because my role is not just St. Louis, it makes it a lot, you know, my time is a little constrained. So we're trying to figure out a system, whether that's, you know, giving you looking at the month of March and there's a week where you can pick a day or something. So I really can't tell you. We're just getting more requests, so I have to kind of take a step back and figure out how to manage this because it falls on me and Dana to provide these tours. So, and I'm not at the hospital every day. So, if you just reach out to me, we'll figure it out. But I am coming up with a process hopefully soon.
Okay, and the support person that would be attending this with the individual, would that support person have to be vaccinated and all of that as well?
For job shadowing, we don't require that. You will have to wear a mask
Okay.
whenever we're in any of the patient main campus, like main floors, anything like that. I'd be happy to entertain a one-on-one job shadow, but I really am reserving the time for a group shadow.
Mhm.
Because if I say, oh yeah, bring whoever, then I'm doing job shadows every day.
Right.
So I'm kind of working with the high schools and the pre-ETS transition specialists to kind of coordinate those shadows.
Okay, thank you.
They join one of those then if you had one set up maybe?
Possibly, yeah. The one from McClure is bringing 12 students. That might be our max. So I'm still trying to determine like what's the right amount. Like we're just, we've done Dream Big for so long, but that's such a different, that's not just job shadowing. That's like a whole program. We have like, it's a lot of other things, not just shadowing. So just trying to figure out what works for us and it is manageable and that gives you guys a good feel for things. Some areas that we just can't get into. So if you have someone who's interested in an area that maybe I don't list, then I would suggest Lunch with the Leader series because we talk about work from home opportunities. We talk about patient care opportunities, things like that. So I would start there. And then if somebody's really like committed, then we can do a job shadow.
Marissa, if you had somebody who was deaf and who wanted to do the pre-employment training, would you guys have interpreters available or how would that work? Or I maybe just stumped you.
Yeah. I mean, we have a gentleman who has a cochlear implant and he uses sign language, but he doesn't require an interpreter. When he came to us for the intake, he had his case manager from Burrs Goodwill with him. But he's able to read lips and communicate. So we would figure out who we would support that. We just have to figure out how.
Okay.
Yeah. I mean, we don't have like interpreters on site or anything, so we would have to partner with whoever.
All right. Anybody else have any questions for Marissa or Dr. Bruno?
Well, we appreciate your time and please reach out and Amy, I'll send you all the things.
Perfect. Yes. Thank you so much, Marissa, and Dr. Bruno for speaking at our mini Transition Tuesday event here. I will send everything out afterward. And again, my email is in that chat. If anybody has any suggestions of other programs or things you'd love to learn more about, please let me know. Otherwise, everyone have a wonderful rest of your day and thank you. Bye.